let's look at patient history taking or patient clerking. That is, when patient comes to your clinic, the series of steps and things you do to get what the patient is concerned about and to make in-depth probing and investigation to identify other surrounding factors in patient's life that is impacting on the disease or on the problem the patient is having, and also how to relate these factors the prognosis or the outcome of the patient's condition and how these factors can be modified. All these, the process of identifying all these factors and relating them to the patient's life and present condition, and also identifying what the patient is suffering from or the patient's concern, they all fall into the clerking or history taking. History taking may be referred to as a process by which patient tells series of stories concerning his problem to a physician or a healthcare provider. It can also be referred to as an interview between a physician and a patient, in which the physician tries to elicit facts regarding the patient's condition or about his or her health condition, directly or indirectly. Directly or indirectly for the purpose of diagnosis and treatment. Okay, so this is a special time to listen to patients and ask relevant questions to determine the cause of the client's complaint and how the client feels about the problem or the complaint. Okay, so this process is a very important and critical point that you need to pay closer attention, because what the patient tells you most times will help direct your attention on how to care for the patient. History taking reveals the following: the beginning and the course the patient's problem has followed. And it tells you when the problem started and how the natural history of the disease, okay, and how the disease has been progressing. It also reveals where the problem is located and its nature. Ma can tell you that I'm having headache by the side of my head, and it is thrown in, like it pains me, it doesn't allow me to sleep. It tries to tell you the location and its nature. It also reveals to you the quantity and quality of the problem. By how the problem has been disturbing the person, it can quantify and also tell the quality of the problem. Then it also reveals under what circumstance the problem is aggravated and relieved. I can tell you, when I take tea or when I take paracetamol, it stops. When I lie down, it stops. Whenever I wake up in the morning, the headache is so much. Okay? Then it also reveals associated manifestation of the problem. You might think, I also have vomiting. I also have vomiting and vertigo. I feel dizzy. Okay, so these are the things a good history or adequate history should review about the condition when you are carrying out history taking. Elements of history. 1. Biodata. 2. Presenting complaint and duration. 3. History of presenting complaint. 4. Past medical and surgical histories. 5. Family and social histories. 6. Drug and allergy history. Then 7. Review of system. Let's look at the first element, biodata. The biodata or the patient's profile. Under here we have the age, the name, sex, occupation, religion, ethnicity, marital status, and address. So this is what you found out biodata. The name is very essential in this clinical or history taking. It's very essential for you to determine the name of the patient, but most times you will have to address the patient by their names. Secondly, to determine when the treatment is meant for the person, because it will be written on the patient's card, so that you not take the patient's treatment for another patient's treatment, like Mr. A's treatment for Mr. B treatment. So it's essential and for courtesy purpose. Okay. Then address. Address is very important for tracing the factors and for home visiting. Age. Age helps you to determine the drug dosage, dilution. Okay, and also it helps you to determine some conditions, some likely conditions do occur at certain age range. When we talk about cancers, although rarely you can see them in neonates, there are some cancers like breast cancers, prostate cancers. You cannot find prostate cancer in, say, in an adolescent. Age helps you to a diagnosis. Okay, so it is meant from at least person from 50 years above. So age helps you also in making diagnosis. Okay, then sex. Sex is important in the sense that at some point in time, some diseases are sex specific. You cannot talk about breast cancer in a male, neither will you talk about prostate cancer in a female. Okay, so some disease conditions are age specific. All right. Also, in that sex, at some point in that particular sex, some disorders tends to occur at a particular age or period, like menarche, menstrual related disease. We don't talk about dysmenorrhea in a female that is below. Are you getting me? Then also in postmenopausal, it might present with a lot of symptoms, flu-like symptoms, as in symptoms that are not non-specific. But because it is sex specific, you can begin to say, this woman has passed the age. That's when you now combine age, and there is likelihood that this is postmenopausal syndrome, or this might be premenstrual syndromes. You see, so these are where age, sex helps you to make diagnosis. Okay. Also, in recent times, occupation, religion. Occupation will treat it in social aspect of the history. Yeah, religion helps you to know how you present some certain things, because some religion forbids some certain things, and this may not be really accepted by the patient. Okay. Then marital status. When you talk about marital status, especially support persons in pregnancy, there are this situation to occur whereby when there's no support, maybe the person is not married, there's likelihood of psychological related deviations. That's where marital status comes in, so that it will help you in the management modalities, so that the patient will not tilt in that direction. So that's why marital status becomes very much important. Support persons. Okay. Then also ethnicity. Yeah, ethnicity is important because some certain disease conditions are meant to occur in certain ethnic groups. So it also helps us to make diagnosis, like Kawasaki diseases, Rocky Mountain disease, they are specific in specific ethnicity, ethnic group, or geographical. Like malaria, known for sub-Saharan Africa. So your ethnic group, also this sickle cell disease or threat. There's this sickle cell for SS and SSC. SS is specifically for eastern part of the country, Nigeria, while in the middle bed layer can have SC. So ethnic group also helps in making diagnosis. Okay, then you can also talk about address, like we said, helps in tracking the patient's location should in case the patient deviates from the treatment. The next is the presenting complaint. The presenting complaint, this is the complaint that brings the health patient to see the health worker. That's the most troubling one, because sometimes patients might be having pain, maybe having other symptoms that is not disturbing his or her life, and the person will just feel okay and be managing himself. But there's a particular one that will occur. The patient will just move. That particular one is the one that gives the patient concern, and that is known as the presenting complaint or the chief complaint. It is a brief statement, mostly in patient's own words. It is the symptom that propels the patient to seek for medical attention. Maybe a severe headache, or inability to pass through, or passing blood from feces. So that is known as the presenting complaint. So under that presenting complaint, you have to look at it on the 4 C's: the complaint, the cause, how long has this been? You ask the question, how long has this particular complaint been? Then the likely complications that can follow this presenting complaint. You also have to have it in the back of your mind and ask as well. Then care received. You need to ask for the care received based on this presenting complaint. Okay? And the presenting complaint usually has an underground known as the presenting illness. Presenting illness is the cause of presenting symptom and other manifestations. It is the cause of clinical manifestations. Okay, so that the presenting illness could be maybe this headache with personal blood, with maybe cough and catarrh. Maybe it's a multisystemic. It's now a multisystemic, which might be as a result of complication from bacterial infection. Okay, so the presenting illness is behind presenting some symptoms. Okay, so you have to ask the cause. How long has this condition been? What have been done? How does it affect you? The complications, care received. So we will talk that in details later in these lectures. Family history is the next. Family history tries to look at basic 5 diseases: hypertension, epilepsy, asthma, diabetes, and sickle cell or stroke. But not limited to that. Okay, hypertension, epilepsy, asthma, diabetes mellitus, sickle cell, and stroke. Okay, family history consists of the collation of information about the patient and other family members. Family history provides clue, or it reveals heritable diseases, such as we mentioned above, but not limited to it. You can also have psychosis. Okay, it reveals the disease that can be inherited. Secondly, it also reveals current family health status. Current family health status. Okay, it reveals it if you take it very well. It also reveals presence of psychosocial disorders in that family, such as divorce, loss of job, or bereavement. Sometimes patient might come to your facility and present no specific symptoms. Even though you start attending with symptomatic approach, the cause may just be psychological related. And if you don't follow it psychological wise, you will not get the patient. Okay? Such as hysteria. So it also provides interaction and relationship among family members. It also provides the avenue to know the interaction and the relationship among family members. Okay? Adequate family history may help in prevention of serious risk to life of other family members. A careful family history not only helps in management of a particular patient disorder, but also provide the clues for screening and identifying others at risk for that same disease. Thus, it helps in providing timely intervention. It is important to determine if one or more members of the family is experiencing or has experienced symptoms similar to those presented by the patient. Family history also enables health workers to understand the interaction and the relationship in the family, because most times the illness of one member of the family may alter the family's role and functions due to incapacitations. So sometimes it may be a situation where the father is the head of the family and has a younger children or still the babies, and father has a serious problem. It actually means that the family will begin to have issues. Okay, so these are the importance of family history. It enables you to identify diseases that can be inherited: hypertension, epilepsy, asthma, diabetes, sickle cell, stroke, and psychosis related illnesses. Okay, and especially during pregnancies and preparing. So family history is very, very important. Now let's look at past medical history. Past medical history tells more of patients' past medical conditions, the duration of the treatment, the duration of the disease, treatment options, previous hospitalization, childhood illnesses, blood transfusions, etc. Past medical history provides guides on planning the management of a particular patient, because some conditions are better managed in a diagnostic facilities. So when you hear the past medical history, that is what the patient have suffered before, it might give you a clue that this same complaint this patient presents might be the same condition he suffered a few months or a few years ago is about to reoccur, of which, if you are not careful enough, might be complicated and you might lose the patient. So it will help you think and to see the way forward, either to refer this patient or not. So that is why it is good to take past medical histories. Now let's talk about social history, or you can say personal history. Social history usually consists of brief narration about the patient's way of life, such as habits like smoking, tobacco, alcohol use. Okay, it also tells us about the occupation, okay, and also marital status. This aspect of history is important because it provides an insight on prevention, of complications. Okay, it helps in prevention of complications and reoccurrence of some conditions induced or facilitated by patient's social factors. Okay, for instance, smoking is a very big risk factor for cancer, and maybe the patient presented severe cough, severe dry cough with chest indrawing. So social history can actually affect the outcome and the process. Also, some social histories can complicate the treatment options. Some of them who work in where the mind cold, I suppose a lot of what is occupational related diseases. So the occupation of the patient will help you determine if this patient needs to return to this work. Like someone who has been exposed in X-ray for a very long time. Okay, people who butcher meat that are exposed to brucellosis, anthracis, and all that diseases that come from zoonotic diseases or zoonosis. So by the time you understand this, it will help you to make a better treatment plan and option, and also educate the patient to limit exposures or entirely avoid them, because they can actually impact or cause the condition to worsen. For the child also, the person that takes care of the child around in the house, whether the mother or the caregiver, all those things within that child can also be a factor that can cause the problem to continue or not to continue or to get worse. So the patient's interaction with the environment has a significant impact. Like we say, man influences his environment, and environment also have impact on the man's health. Take for instance, you defecate in the only source of water you could use in your community. Then you still go back and fetch water from that community. You recycle the disease, and the disease chain or cycle will continue. So that's why man's activities on his environment affects his or her health. So that's why we also have to consider social history. Someone that's having hard of hearing should not work where they operate high machines or heavy machines that produce decibels of noise. Okay, so that's how social history plays a role as well. Now let's look at review of system. The purpose of review of system is to determine malfunctions in areas not covered in the present illness. Yes, most times maybe the patient presented, maybe let's say cough, catarrh, fever, body pain. These are flu-like symptoms, of which we can attribute it to maybe viral infection, upper respiratory viral infections, coronavirus, influenza, and all that. Okay, but it might not actually be true. It might also be as a result of other viral infections that affect the lower tract infections, lower tract structures. It can also be a kind of non-specific for other conditions. Sometimes malaria can be funny, can present that way, although with its fever and chills and rigors. Okay, so when you now begin to review systems one by one, it might show you, sir, are you passing out blood? Are you stooling? Are you having pains at your back? It will begin to show you. You don't even know that this person may have been having tuberculosis in the spine, extrapulmonary tuberculosis. You must also identify structural deformities. Okay, so it helps you to determine areas not covered in the present illness. It also serves as a check for manifestations of the present illness that was previously overlooked or forgotten. Okay, but remember that system review depends on the chief complaint. Okay, like take for instance, the chief complaint is just cough. You will also have to go further to ask for related symptoms like production of sputum, the color, the quantity, breathlessness. You also have to check the heart, because the heart and the respiratory system are almost together. You begin to act of palpitation, pains, cyanosis. Okay, you begin to ask questions in that regard. System reviews depends on the patient's chief complaints. Whenever a particular complaint suggests involvement of a particular system, it is important to inquire for other possible symptoms associated with such organ or system. Remember, constitutional symptoms is exceptional. Yes, there's symptoms that are non-specific, like we said. Fever is non-specific. Fever can originate from infections, from metabolic related, from drug overuse, from a lot of even cancers. Okay, so it is non-specific. Weaknesses, cachexia. Okay, so these you should always consider. Now let's look at descriptors. You can recall earlier when we are discussing on presenting illness or complaint, we looked at 4 C's: the complaint, the cause, the complications, and care. Now you cannot talk about the cause clearly without using descriptors. For us to know the natural history of that disease, how far the disease is going and how it's affecting you, some certain words are used when you're asking questions about the person, about the complaint the person complained. The person complained, I'm having headache. You need to find out where, how, when it started, what stops it and what releases it. All these things have a good role to play in helping you to determine what can be the likely cause and how severe this condition can be. Okay, so the words used are called descriptors, and this has to limit errors due to overemphasis or underemphasis. Emotional to say everything the way they feel, but when you use these descriptors, it helps you to guide them. That's why in consultation you say you have to listen with understanding. You have to listen with understanding so that you will guide the patient. And how you guide the patient is with the use of these descriptors. Take for instance onset. You always have it at the back of your mind that every symptom has an onset. It has when it began. It has when it began. So these words are used to determine when it began. It can be abruptly that the condition just started. Madam, how did this condition begin? It just started just like that in the morning. I wake up, I start seeing it. Or gradual. It's been long, the thing have been giving me signs, so but I have been overlooking it. Gradual. Abrupt signifies severe condition, acute condition. It may not be severe anywhere, but acute. Then gradual can be chronic condition. I started seeing this thing growing in my body. Gradually, it started increasing. Okay. Insidious, that is, it's as if it will, it's not serious. It's just like, but sometimes it gives me headache, it goes. Sometimes it pains me, it goes. No, insidious. Okay. You ask, how did this condition began and when? Onset. It helps us to identify. Okay. Then another word is symptom history. These are words used to describe the duration of each complaint or symptom. So the essence of this determining the duration, after you have identified onset, how did this begin? The next is duration, how long? Okay, you ask how long has this condition been? That's the next thing. You are trying to determine the duration so that you can judge whether it's acute. If it's less than a week or 2 weeks, then it is chronic if it has lasted more than that. Okay, so how long has this complaint been? Then the next is trying to determine the episode. And the episode that is, how often does this condition occur? It will help you to determine if this condition is so severe. Like some abdominal pains, they occur intermittently. Like this. For example, ulcer occurs intermittently. That is, you might eat now, it starts and it stops, it begins again. So that intermittently is trying to tell you how severe it is. So you ask the woman, how do this complaint occur? The person, every time, you know what? Intermittently. It's not telling you how severe it is. Then, or frequently, or occasionally, or it is increasing or decreasing. So this thing that is growing on your skin, how far? It has. I think it is lessening. It is coming down gradually. That is, we are trying to determine the episode and to know the severity, because the severity will tell us how urgent the care should be. Then, another words are, you ask the patient to describe the symptom. Okay, that is the character. If it is pain, he asks if the pain is sharp. If the patient is sharp, if pain is dull, if the pain is burning, if the pain is superficial, crushing, squeezing, hot or cold. Trying to ask them to describe that particular symptom, mainly pains, growth and all that, or discharge the person brought out from his body. What's the color of the mucus? If it is greenish, you suspect something. If it is whitish, you suspect something. If it is mucoid, you suspect something. If it is bloody, you suspect something. All discharge from the nipple, from the breast, from the ear, from the mouth, from the nose, from the eye, they have specific causes depending on the quantity, color, thickness, thickness, smell. So you are trying to describe the character. So that's why we say we use descriptors to describe that presenting symptoms, because you have to state the complaints in that presenting symptoms, how it's affecting the person, the cause. You have to identify it. Okay? So if it is dull, you begin to suspect. If it is abdomen, you begin to suspect intra-abdominal organs. But if it is sharp, localized at one point, it can be fascias, muscles, or tearing within the muscle layers. It better not be intra-abdominal. Okay? Then if it was not localizing before, the later it localized, it will now tell you a different idea. We're coming to location. It now gives you a different idea. So these words are very much important in describing patient complaint. Then you also ask of alleviating and exacerbating factors. You ask, what makes this condition worse? This is your headache. What makes it worse? Say, whenever I eat, or whenever I wake up in the night, or whenever I lie down on the bed, or what makes this cough worse? So this will help you to know. This can be in form of exercise, medication, treatment, rest, sitting, lying down, or sleeping. Then lastly, location and radiation. This one has to do with pains, mostly pain. The person can say, "As where do you feel this pain most?" That is location and radiation. It can maybe if it is all these acute abdomen conditions, maybe rupture of the pancreas or rupture of or twist interception, or any of all these conditions that lead to acute abdomen, ruptured appendicitis. At first it's unlocalized, then as time progresses it localizes in the inguinal region. You begin to suspect possibility of ruptured appendicitis, and then diffuse pain. You suspect peritonitis. Everywhere is now painful. So location and radiation also helps in describing the symptom. So when patient comes in that presenting illness or complaint, you ask, which day did this symptom start and how did it begin? Then you ask the duration, how long? Then you also go and ask, depending on the symptoms the person have mentioned that brought the patient there, you now begin to ask, how does this complaint occur? Maybe the person said fever, cough, catarrh. You take them one by one. Fever starts and the cough starts with this, at so time. You take them gradually. Then if it is something like discharge, you can ask them, can you describe the symptom? Can you describe this symptom? Blurring of vision. How? Can you really describe it? The person might tell you, I used to see floaters, something floating and cover my eye. Or it used to itch me. The person is describing the symptom. Then alleviating and exacerbating factors, like we said, what makes it better and what makes it worse. Then finally, location and radiation. So these terms are used to describe the cause, the natural history of that disease, because it's the presenting illness that leads to presenting symptom. Okay, so these are the use of descriptors. Importance of making clients comfortable during medical interviews. 1, it enhances communication between the healthcare worker and the patient. 2, a relaxed atmosphere makes patient feel free and eases the patient's anxiety. It promotes comfort. It ensures privacy. It reassures patients. It also promotes confidentiality.